Joining me now is one of the most respected members of the United States Senate, Susan Collins of Maine. Senator Collins, the Alzheimer's community is so fortunate to have you in our corner. I particularly appreciate how closely you work with our organization, Us Against Alzheimer's. Senator Collins has earned a national reputation as an effective legislator who works across party lines to get things done. For the past 8 consecutive years, she has been ranked as one of the most bipartisan members of the United States Senate. She serves as a senior member of the powerful Appropriations Committee. She's a member of the Aging Committee, the Health, Education, Labor, and Pensions Committee, and the Intelligence Committee. She's a busy lady. She founded the Senate Diabetes Caucus and has led the effort to more than triple federal funding for diabetes research. Thank you for that. She's championed the efforts to lower the cost of prescription drugs. As the founder and co-chair of the Congressional Task Force on Alzheimer's disease, she has worked to increase funding for Alzheimer's research and to strengthen support for family caregivers. In 2011, Senator Collins authored landmark legislation creating NAPA, the National Alzheimer's Project Act. So we will ask you questions about that and about your other activities on behalf of the Alzheimer's community. So I thank you for being here with us today. Senator, you are the senior ranking member now of the Appropriations Committee, and who knows what's going to happen in the midterms. So you can be chairman or the ranking member of the Appropriations Committee. You're on the Health Committee. You're on the Aging Committee. So you are a leader in all things healthcare. And so I'm curious as to how you see the next 3 months and then the next couple of years in terms of health priorities. What are your priorities for that period of time?
Alzheimer's research will continue to be very high on my priority list. Healthcare in general is of great interest to me, and as a senator representing the state with the oldest population in the country, I'm particularly focused on diseases like Alzheimer's and diabetes that affect older Americans. So I'm really proud of the work that we've been able to do in increasing funding for essential biomedical research. The progress that we have made, thanks to the advocacy of Us Against Alzheimer's and other groups, has just been extraordinary. When I first founded the Alzheimer's Task Force in the Senate, there was very little focus on Alzheimer's disease and dementia in general. In fact, people were still unclear that dementia was a disease. Think about when we were growing up, you would hear people described as being senile, as if it were an inevitable part of aging. So I think we've come a long ways towards those days, and toward achieving our goals. My hope is that the end of this year, when we finally do the omnibus appropriations bill, that we will see as much as $3.5 billion for Alzheimer's and other dementia research. That would be a record high and a long ways from where we were many years ago.
You know, when I started my organization, you spoke at the launch with Sandra Day O'Connor.
Yes.
Which is tragic because she's died of the very disease that she was advocating on behalf of her husband at the time. It was, just as you say, virtually standstill in terms of any government efforts or focus on this disease. So thank you for that. But one of the things that's driven this has been the National Alzheimer's Project Act, or nicknamed NAPA. That was your brainchild back in 2011. So what did you hope to accomplish, and have we achieved what you hoped we would achieve with NAPA?
NAPA was the first major legislation, a bipartisan bill that I introduced with Senator Evan Bayh that focused on Alzheimer's, set up an expert council to help us figure out how much we needed to invest in the disease, and set a goal of achieving a means of prevention or effective treatments or even a cure by 2025. That was an ambitious goal, but it was important to have that kind of goal. The result of that legislation was that the expert panel recommended that we should be investing $2 billion a year. Now, back then in 2011, I think the amount that was being allocated for Alzheimer's and related
400
dementia.
million.
That's what I was going to say. You know the exact figure. So think what a stretch it was to have this panel of experts say 400 million isn't nearly enough to make progress. You should be investing $2 billion. We needed that kind of expert advice to make the case. Advocates needed it, we needed it in Congress. So I see NAPA as being a real breakthrough in focusing the country's attention, the biomedical research community's attention, the advocacy groups' attention, and most of all, the attention of members of Congress on the need to greatly ramp up funding.
You know, back in those days, it was taken as a given that Congress would never allocate more money to one disease over another disease. And NAPA changed and broke that paradigm to actually allow us to focus on the diseases of greatest suffering, the greatest cost, the greatest impact on American society. So thank you for doing that. It really is, as you say, quite a breakthrough in how we approach this disease. And we kept going. So you now are looking to reauthorize NAPA, because it was authorized only through 2025. What do you hope to achieve with a reauthorization, and are we resetting our goals?
I want to keep the momentum going. That is so important. And the funding is so critical. You're absolutely right that it can be a battle to single out specific diseases for increased funding. We've done it with cancer, and it's led to breakthroughs. And if you look at Alzheimer's disease, it is our nation's most costly disease. Mm-hmm. If you look at the trajectory as our nation is living longer and more people are having to battle this devastating disease, it is evident that we must continue the trajectory of increased funding, and also looking at other factors and directing the research in other ways, such as the lifestyle factors that you've worked very hard on. But the amount of money that our country is projected to spend on Alzheimer's and related dementias is $1 trillion in the year 2050. So that should be a clarion call to reauthorizing NAPA, to strengthening it, and to continuing the journey that we're on. I would also say it's not just the financial cost, it is the human cost. Those of us who have lost loved ones to this devastating disease, I lost my father, my grandfather, 2 uncles. I know full well the toll that it takes. And caregivers, those heroic spouses, those home health aides, other family members who have stepped in, particularly in this time of shortage of home health aides, it's really difficult for them as well, and takes a toll on the health of spouses who are often confronting health problems of their own. So it's really important that we look at how we can support caregivers too.
So it is, you're absolutely right. It is a family disease. It is not an individual's disease. And the cost to caregivers out of pocket, as well as cost to the federal government, and the pain and suffering of multiple generations. Substantial number and percentage of caregivers are now teenagers, are now young people, or are grandchildren, and they're taking care of their grandparents. It is a remarkable impact. I lost 3 generations of my family to this disease, and that's why I've committed the rest of my life to it. So you're absolutely right to focus on the family as well as the individual with the disease and the cost to the nation. So I'm curious, so you talk about modernizing the NAPA. So I'm curious about what you mean by modernizing as well as just reauthorizing.
Well, we've learned from the research, we've learned that there are some tantalizing other areas to pursue, and one is that there may be lifestyle changes that can be made that would help slow the onset or the progression of the disease. Think if we could just delay the onset by 5 years, what a difference that would make to the quality of life of so many people, whether they have early onset Alzheimer's or whether it's a later stage in life. It would make such a difference. So we need to look at those issues. We also need to look at other very tantalizing research aspects. For example, many of the clinical trials have focused on the buildup of amyloid plaque in the brain. But now there's some evidence that inflammation may play a role, that the tau protein may play a role. It's very hard with this disease to figure out what is the consequence and what is the cause. And I suspect that ultimately we're going to learn that there are multiple factors that are involved. We also know that vascular diseases can lead to the onset of dementia. So there are all these tantalizing research leads that are being pursued, but we need to elevate and expedite that research.
One of the things that I had hoped when I joined the NAPA Council at the outset was that this would become a national plan, not just a federal plan. I'm curious as to whether you think that we are doing enough to integrate the government efforts and private sector efforts in order to achieve the goals of NAPA as we move forward.
That's a great question. There is exciting research, not always federally funded, sometimes funded by pharmaceutical companies, sometimes occurring in university settings, that is going on all around this country. I've visited, for example, the researchers at Harvard, at Jackson Laboratories in my great state of Maine, at the University of Pennsylvania, at the Mayo Clinic. There are a lot of research centers, and we do need to make sure there's support, there's coordination, there's federal funding, but also we need more sharing of information, of the results, and sometimes that occurs. It occurs when there's federal funding, sometimes it doesn't. That's why, for example, I would say that the effort needs to not just be national, it needs to be international, because there is exciting research that's occurring overseas as well. And that's why these summits have been so important.
You know, we 2/3 to 3/4 of the cases of Alzheimer's are in low and middle income countries. We think we have a large baby boomer class of 76 million people. China has a baby boomer class of 460 million people. India has a baby boomer class that's larger. So you're absolutely right that there are brilliant people around the world. There's research going on around the world, and there's very little international commitment to this. So focusing as you have on international and global efforts to bring together both resource and brains around the world is so central. So I congratulate you for thinking that way, because very few members of Congress think that way. So thank you for doing that. You know, one of the things that you did during the course of the last several years is create a professional judgment budget. This was basically asking NIH every year to tell you how much additional funding they needed in a following fiscal year in order to try to achieve the 2025 goal. That has worked, I think, brilliantly in creating a real conversation between the executive branch and the congressional branch in terms of sharing this goal. Do you think that a professional judgment budget ought to continue as we go to 2035?
I definitely do. Right now, what would happen otherwise, as you well know, George, is the budget from NIH goes through OMB, and OMB is looking at numbers. It's not necessarily, with all due respect to OMB, but its job is the budget, numbers. It's not really focused on policy, nor is it really focused on long-term savings, which if we conquer this disease are going to be enormous to the federal budget, to both Medicare and Medicaid. So it's really important that NIH be freed from the constraints of OMB and able to communicate directly to Congress on what the needs are. I think that is absolutely critical. You know, every year, Francis Collins would come before the Senate Health, Education, Labor, and Pensions Committee, on which I serve, and he always knew that I was going to ask him this question: how many worthy grant applications are you receiving for Alzheimer's disease that you cannot fund? So after I asked him the first couple of times, he came prepared with a chart showing me how many there were and how many they could fund. And I'm talking about worthy applications, one that would advance our understanding of the disease. And there was always a gap. But if you work, and I think the world of Dr. Collins, I call him my cousin, even though we're not related, and he's made a real difference in helping to advance the research. But you're absolutely right, that professional judgment budget is essential to guiding us.
As you think through the inclusion of risk reduction factors in our national plan and look at the professional judgment budget, which is NIH-centric, how do we get to a place where we begin to take account of the cost savings and the cost investments we should be making in risk reduction interventions that could delay or prevent a significant percentage of the cases of Alzheimer's?
It is really interesting to see the studies that have focused on vascular diseases, heart disease, for example, and the general health of the individual, how they eat. My mother always swore that the Mediterranean diet that she adopted delayed my father's onset of Alzheimer's, which ran so heavily in his family, till he was in his mid-80s. And I, you know, she may be on to something based
Absolutely.
on what we're
Smart
seeing.
lady.
Exactly. And exercise, all of those may be factors. So I think it's important that we pursue that avenue aggressively, because if there are steps that each of us can take right now that would help delay the onset, we need to know about that. We need to have it further explored and backed, but we need to know about it. So that's why I think it's so important. And thank you for all your work in making sure that that became part of our goals.
Well, one of our objectives now at Us Against Alzheimer's is to think through how we can bring the private sector to that conversation. because if anyone knows my behaviors, it's probably Facebook or Twitter or somebody out there in social media land. And if we can enlist employers who have a deep interest in healthy aging because of the pension plans they have, because of the health of their workforce, if we can enlist the technology industry, if we can enlist the lifestyle industry in trying to align themselves with that goal and create a national effort, a whole of society effort around healthy aging, this society will not only benefit all of those who are aging, which is better than the alternative, as they say, but it also is going to, as you say, reduce the cost to society. So I think, I noticed that you put OMB on the NAPA Council this time around. I'm curious as to whether that was a hint that maybe we ought to be thinking a little more broadly.
It is indeed. I hope that if OMB gets more exposed to the research, the amount of money that is needed, and the potential cost savings, that it will change the natural friction that occurs between OMB and virtually every other federal agency. This is not unique to NIH. And I think it would be good for OMB to be exposed to what the research can mean in lowering Medicare costs, Medicaid costs. It's not going to lower it, but it'll prevent this explosion in Medicare and Medicaid costs.
Well, I congratulate you for your thinking on that score. As we know, research is essential to progress here, and you've done so much with the NAPA effort and the funding effort. But we also need eventually to get drugs to people. So I'm going to ask you about the next step. There are two of them. One is regulatory, where we saw the FDA now using accelerated approval mechanisms to approve a drug for some large-scale fatal disease that has a real substantial evidence base for having effectiveness. The other is Medicare, who has to cover these drugs in order for their actually people to get them. I'm curious about what you think about the accelerated approval mechanism. Is it useful? Should we be continuing to use it? And then I'm going to ask you about Medicare.
I support the accelerated approval process. It has allowed hundreds of valuable pharmaceuticals to reach the market far earlier than they otherwise would for diseases that have been really challenging for our country. And the FDA still has a very rigorous review process, so I don't want people to get the impression that somehow safety is being compromised. It is not. Senator Tim Kaine and I have introduced a bipartisan bill to help strengthen the accelerated approval process by putting more transparency into it so that there'll be better understanding of FDA's decision. But I have a lot of confidence in FDA, and I think I can anticipate what your next question is going to be, but I'll wait till you ask it about CMS.
Thank you. Well, as you know, we did get an FDA-approved drug last June of 2021. FDA found it to be safe and effective and approved it under the accelerated approval process. Medicare disagreed and refused to cover it, and now that drug has been withdrawn from the market. I'm curious what you think about the Medicare decision not to cover an FDA-approved drug found to be safe and effective.
I completely disagree with CMS on its decision. And I cannot recall another time when the FDA has certified and approved a drug and CMS has refused to cover it.
It's unprecedented, so your memory is good. There is no
That's
such
good.
case.
I think this is outrageous, and it is not CMS's job. CMS got way outside of its lane. It is not CMS's job to deny the use under the Medicare program of an FDA-approved drug. particularly citing safety reasons. Now, I think the real reason was cost and not safety, but CMS claimed safety reasons. Since when does CMS make decisions on whether a drug is safe? That's the FDA's job. Now, if FDA ignored safety data, that would be of great concern to me. But CMS has not been able to point to data that indicates that. I wrote to the administrator of CMS to express my strong disagreement with its decision. And here's what really bothers me. I think this chills the development of other drugs in the same class because the manufacturers are going to be hesitant about proceeding with research, which is very expensive, and clinical trials, and going through the FDA's process, if there's no guarantee that CMS is going to approve it.
Well, Senator, you have been terrific. You know science, you know finance, you know the government's budget, you know regulatory issues, and you know coverage issues. So you have demonstrated an extraordinary range of knowledge about the Alzheimer's and related dementia fields and healthy aging and how it relates to Alzheimer's. So I want to thank you for your efforts. I want to thank you for the clear study and attention you've paid to those of us out in the world who have experienced Alzheimer's in our family, as you have, as I have, and the millions and millions of people who have. So thank you for your attention, your focus, and your leadership on this.
Well, thank you, George, and let me turn around the compliment and thank you. Your advocacy has been tremendous in supporting the work that we're doing on Capitol Hill. We could not do it without your work and without advocacy groups standing there with us making the case. And I'm very grateful to you for your commitment. And believe me, this is a passion for me. Thank you.
Thank you, Senator.